And now we're happy to next introduce Dr. Reena Khurana. She's an endocrinologist active in building community capacity in diabetes, especially diabetes and pregnancy, and leads the Specialist Society in BC efforts in diabetes. Today, she's going to talk to us about diabetes prevention, support after pregnancy for South Asian women in Surrey. And welcome.
Okay, thank you. Thanks for this opportunity. Welcome everyone from India and all over the world, I guess. I'm Reena Khurana. I'm an endocrinologist at Surrey. I work at the GPs and Diabetes Pregnancy Clinic. I'm a shared care committee specialist representative, and I'm one of the leads on this project. This project is called Diabetes Prevention, Support After Pregnancy for South Asian Women in Surrey. And I don't know if people in India don't know, but in BC, a lot of us do a territorial acknowledgement. So I'm just going to say it. I acknowledge that I'm speaking from the unceded and traditional shared territories of the Salish, Coast Salish people, specifically the Katsi, Semiahmoo, Kwantlen, Coquitlam, and Tawasin First Nation. So these are our objectives for today's presentation. And we'll do a bit of a background, what the project is, what problems are we trying to solve, and what our aims are, and what's next. This is our background. So gestational diabetes is characterized by high sugars in pregnancy. Diabetes only diagnosed in pregnancy, not before pregnancy, because it resolves after delivery, after the placenta is delivered. The global prevalence of gestational diabetes is about 17%, but it depends what region you're in. High sugar, why do we care about gestational diabetes? Because high sugars are toxic to the baby in pregnancy. Gestational diabetes usually happens, we usually screen it for 24 to 28 weeks. The complications from diabetes in pregnancy includes for the mother, C-section, high blood pressure, which causes something called preeclampsia, which can be very serious for the mother. For the baby can be very big, can be born with a low sugar, have jaundice. If delivered vaginally and is a big baby, the shoulder can get stuck and that can cause nerve injury. And there also could be lung issues after delivery. So there's a lot of data that shows that treatment of gestational diabetes is proven to reduce complications. We know that for sure. And the primary treatment is really diet and lifestyle. Like when they come to the clinic, we get them to check their sugars up to 6 times a day. We really focus on diet and lifestyle. That's very specific for their culture as well, because we have a large amount of South Asians in our clinic. However, despite really good diet and lifestyle changes, 60% of these women do require insulin at our clinic, which is really much higher than a few years ago. And there could be a lot of reasons why. But anyways, after delivery, we want to screen these women for diabetes because some of them may have had diabetes and not know about it, or may still have diabetes after birth. So postpartum, around 6 to 8 weeks time, we do a 75-gram oral glucose tolerance test. The same test that we do in pregnancy, we do, and that's about 2 hours of the woman's time to do that test. Women with gestational diabetes have a 40% chance of developing diabetes by the time their child, who they were pregnant with when they had diabetes, turned 16. So these women are very high risk for diabetes. So we want to focus on prevention of diabetes in this population. But specifically, we want to focus on South Asian women in Surrey and North Delta. Family doctors and endocrinologists were part of the shared care committee, which is a collaboration between the two. And we're part of we're working with the Division of Family Practice to develop a shared care project aimed at reducing the number of patients who fall through the cracks when transitioning from our specialized diabetes and pregnancy clinic back to their primary care provider after delivery. And we're going to focus on the South Asian population because that's the largest ethnic group by far seen at our clinic. And in collaboration with other partners like CINI and so forth, we want to develop culturally specific recommendations for the awareness and prevention of diabetes. So who's in our team? There's a number of family doctors and endocrinologists. I'll be showing you the list at the end. We're working with Fraser Health Operations. We have support from them. We have support from the clinic itself. We're working with our community partners, CINI, UBC Icon with Kendall Ho, and Self-Management BC with Patrick McGowan. And the project support is from the Division of Family Practice and Shared Care. So this is our timeline. We're just in the baby stages. We're in the initiation exploration. We just got funded back in February. Hopefully in the fall, we'll start the data analysis and initiative design. And then by the new year in 2023, we want to start working on it and do some evaluation. And then we always look at sustainability because that's important. We just don't want to just do one-off project, a pilot project. We want to be sustainable and see we can whatever we decide to do that it will work. And this largely will be through a QI lens. And in the end, we want to, of course, see what the outcomes are and publish those and present those. So what problems are we trying to solve? There's an absence really of culturally relevant community interventions, resources, or any streamlined care for women with South Asian descent postpartum. So we don't have anything specific for South Asians, really. We have a little bit in our clinic, but nothing really grand. There's also an inequity of postpartum care for unattached versus attached. What do I mean by attached? Attached patients are ones who have a family doctor. For those who don't know, in BC, we're in a family doctor crisis. 1 in 5 patients don't have a family doctor. So that population, there is gross inequity in that population. There's also a low rate of postpartum screening for diabetes, not just in BC, but all over the world when you look at the data. We just did 1 month in October to November. Only 25% of those women completed their oral glucose tolerance 3 months after giving birth. So what are the possible reasons? Well, the patient themselves have to book the test and complete it, and it's 2 hours, right? So this busy mom has to take 2 hours at her time. They also have to book their own checkups for their baby and themselves after delivery. There may be a lack of motivation. It's like, oh, I did all that work. I don't really want to do it anymore. I don't want to deal with eating healthy, I guess, or not eating sweets, that type of thing. Or just, they're just super stressed out, right? Lack of incentive. There's really a lot of women I find have inadequate postpartum support. Despite being married, or if not married or married, having a big family, they still lack support. And that's just my observations. And there's lack of childcare. Some women don't have any family to help take care of their kids and their husband's working. So what are they going to do? Go for a glucose tolerance test for 2 hours? And mothers, like I said, have a very hectic schedule. If you can imagine, if you had a baby, every 3 hours, you're feeding that baby. So it's very challenging for these women. So what are the aims of our project? Right now, we want to definitely increase the number of women doing those glucose tolerance tests to screen for diabetes. We want to increase the awareness for the patients, sort of the risk of having gestational diabetes. We want women to be take control of the prevention of diabetes, like with diet and lifestyle changes. We want them to stay healthy in the future and at least delay the progression or prevent the onset of diabetes. We also want to help family doctors improve their confidence in supporting these women postpartum when transitioning back to them. We want to improve the family doctors and patients' knowledge about getting regular checkups after birth. We want a streamlined from the diabetes center to primary care. And overall, we want to reduce the burden on the healthcare system and help patients and their families reduce the risk of diabetes, diagnosis, and readmission back to our clinic for gestational diabetes. So quickly, what are we going to do? We're just developing the survey right now. We want to do surveys and focus groups. We're going to ask them what the barriers are for completing the test. What was their overall experience with having gestational diabetes? In general, where do they get the health information and support? Do they get it from the internet? Do they get it from the news, from their doctor? What are the barriers they experience right now being postpartum? Who helps them take care of the health? Is it just them? Do their family help out? And we want to explore cultural diet and lifestyle practices. And we also we're going to do a focus group on the family doctors on their insights and thoughts on the barriers to postpartum care. And we also going to get objective data looking how many women complete those tests and looking attached versus unattached. 1 year, do these women get screened again? Again, attached, unattached. I would assume unattached, not so much. We also want to look at the neighborhood where they are. So maybe we can focus on that neighborhood for specific interventions and what languages they do. Like we have a large Punjabi population, but we have many other different South Asians from different like Fijian, Gujarati, South Indian, and so forth. So we want to know what our population kind of looks like. So in conclusion, we really want to work on preventing women having gestational diabetes because women are fortunate or unfortunate, I guess, it depends on your lens, but they get a warning when they're pregnant that they're at risk for diabetes. Men don't get that as much. So we really have a population that we can really focus on to prevent diabetes and prevent the burden of diabetes and the complications for diabetes. So anyways, so if you're interested in contributing, let us know. This is our members. I'm one of the leads. Dr. Sarah Stafford's an endocrinologist. You may be familiar with her. She's a lead, and Dr. Solomon's also a lead, and we have other family doctors involved. Our contact is Katie Phillips, our shared care project manager. That's her email, and that's it. Thank you.
Thank you so much for that great presentation. And I come from a family that is full of diabetes, not necessarily gestational diabetes, but there's lots of insulin needles out around our family dinner tables. So I always appreciate the conversations around diabetes. In one of the, just looking at numbers, in one of the earlier presentations today, I can't remember exactly the number, but they said there was 18,000 births. I believe that was in just Fraser Health District alone.
Yeah.
So if we are having 18,000 births, what is the prevalence? And you may have mentioned this and I might have missed it, but the prevalence of, or at least a guesstimate of how many, I mean, that's a high number to me, 18,000 births, right? Yeah, just your thoughts around the prevalence of gestational diabetes.
It's probably around 20%, I would think, but I don't have specific numbers. I haven't looked at it myself. If you look at some data in South Asians, it's they also have a higher risk. We have in Surrey, we have over 4,000 births. We're like rival women's now. And we have we are even during COVID, like in the beginning, not so much, but our clinic keeps on opening up days. We've already opened up Monday to Friday. We can't open up on the weekend. We have so many referrals for gestational diabetes. You also have to understand the criteria change for diagnosis. In the rest of Canada, they use a higher threshold for diagnosis. In BC, we use a bit of a lower threshold. So we have a higher rate of gestational diabetes compared to the rest of Canada. But if you look at Fraser Health, yeah, we 18,000 births. Yeah, I didn't know that number, but it's huge. And Fraser Health, we have a lot of young families, not just South Asian. We have a lot of young families. So we know the prevalence of gestational diabetes is high. The burden is high. A lot of these women are on insulin. Strips are not covered. It's very expensive to have gestational diabetes, right? I actually saw the Deputy Minister of Health and I said, we need to work on women getting money for checking their own sugars when men don't have to do that. There's a great inequity in healthcare. Women have the burden of pregnancy. A lot of women are alone. They don't have that financial support, whether they're South Asian or not. So it is a tremendous burden. So yeah, it's huge. Someone asked me, do you have plans to check it again 15 years? No, we don't have any plans to do that. We don't have fundings only for a couple of years, but that's a great question. That would be more like a research project. We're more looking at a QI, trying to see what works and doesn't work. So if anyone has any great ideas, it'd be awesome.
Well, I think it's great that you're actually starting out with the sustainability of your project, starting out with that in mind, which I think is a great. And somebody made a comment, love the quintuplet aim in your presentation.
Well, she's QI. Sujata's like a QI grad.
Oh, that's why.
We love the quintuplet.
Yeah, great. Lisa, I'm going to hand it off to you because you may have some questions of your own.
Well, only to say thank you for a fabulous conversation. And, only to say I trained a long time ago in obstetrics, and I was so pleased to hear you say about the burden, not only for these women down the line, but the burden for these pregnancies. If these babies are big, the morbidity with hard deliveries, this is a really important issue to help women when they're pregnant have optimal sugars. It's so important. And thank you for your work.
Yeah, and I just wanted to add a little bit about the general South Asian. It's the woman is I always tell the woman, when you're pregnant, you're responsible for this baby because you're the one who's eating and, the food's going to the baby, you're eating healthy. But when the baby's born, it really should be a family affair, right? The family should be helping the woman or the mother and helping with the baby. And I think women really take the lead in cooking and lifestyle things, right? Like they're the ones who do all the most of the cooking. I feel like, not just South Asian women, it's in general, right? So really, they're modeling the care of health to their family, and I hope that families, and a lot of families do, they support the mothers in promoting healthy lifestyle in their families, because not only can the women help reduce her risk of diabetes, she can help her family reduce the risk of diabetes. Yeah.
Mhm. Thank
As,
you. Sorry, go ahead, Lisa.
as we keep saying, you know, when women are healthy, families are healthy. When families are healthy, communities are healthy. And this is perfectly exemplifies that.
I love that saying, by the way. I just think that that's such an amazing saying. We had a presentation earlier from some of our colleagues at Fraser Health, and Michelle has actually put into the chat box about a program that they're using. Michelle, did you want to come off mute and just take 30 seconds and tell us a little bit about that program?
Yeah, we had started as actually a pilot project with Surrey Memorial Gestational Diabetes Clinic to remind families to sign up for our Smart Mom project. And as part of the stream of messages is a reminder to go for testing for their gestational diabetes. So it's just one of our streams just to kind of remind our families. And we're seeing that through this, there is an uptake in it. So we're continuing to monitor. Also another stream is also email messages. So we're just kind of seeing whether or not we are seeing people going to follow up, but just any way to promote and remind people.
Well, actually, we're the ones who helped start that. It was actually,
that's right.
Yeah, I was part of that. I think, are you part of Perinatal BC? I'm sorry.
Yeah.
Oh, awesome. Right. I haven't met you yet. Okay, there was someone else before. That's awesome. Yeah. So yeah, that's the smart mom. The text messaging really helps, and we appreciate that. It was a kind of a study between us and women's, right? So yeah, wonderful. Yeah, I'd like to meet with you one day, and you can present to me the data. I haven't seen it yet.
I think Michelle, it might have even been you who mentioned the 18,000 births in Fraser Health. Yeah.
Yeah, we're up there. We're really close to 18,000. We're about 17,500, give or take. We have a lot of, and we have over 1.9 million people. So we're very large, a large health authority here in BC.
I'm sorry I missed your presentation. I was busy this morning, but I will watch it online.
Yeah. Well, and my question was going to be, have you guys kind of connected? But even though you personally have not connected, the programs and the work that you're doing are aligned.
Yeah.
So that's great. So, I mean, we're starting to see that synergy that comes when you start to see the pieces of the puzzle coming together.
Yeah.
Harpreet has a comment here. Great presentation. My daughter was diagnosed with gestational diabetes, and she upgraded her diet and adding in swimming. As a result, her husband, who is very supportive, also lost 15 pounds during the pregnancy. So excited for this project.
Awesome. That's awesome.
That's what you call, you know, when women are healthy, the family is healthy, right, Lisa? That's bringing the dots all together.
Minnie, if I could just say, one of the things, so people online would know, we're making a very concerted effort through South Asian Health Institute within Fraser Health to do this connecting. And I think Reena and been very instrumental, and this through Sehat program, and now in a very concerted way, we'll be approaching all programs in Fraser Health to have a cultural lens and connect with the people like Reena in diabetes. So this is going to be an ongoing work. In a way you could visualize, as I said last night, we take a concept and then we institutionalize the project. So within Fraser Health, we were very fortunate to have South Asian Health Institute, and now we are working through the sustainability of that it becomes institutionalized through programs and services. So this is very exciting.